Vascular disease is still one of the leading causes of death in this country, and I think it will behoove all of us to be informed about it and about the risk involved. We don't know all the things that cause hardening the arteries, but we do know some of them, and certainly one of the biggest risk factors is a genetic one. Folks who have a history in their family of people who having any of these arterial problems are at much greater risk for having them than people who don't have that family history. Probably the second biggest risk factor that I see in my patients is cigarette smoking. All of the smokers are very strongly advised to do whatever they can to stop smoking. If they don't, no matter what we do, the disease tends to progress and get worse over time. High blood pressure is a significant risk factor. People who are overweight have a little greater incidence of developing this problem than people who don't, and people who have diabetes are at greater risk for this problem. Well, it depends very much on which part of the arterial circulation is involved. People, for instance, who have plaque disease in the carotid arteries carrying blood flow to the brain are at risk for having a stroke due to impaired blood flow to the brain, or due to little bits of the plaque material breaking loose and blocking smaller arteries up inside the brain itself. A typical symptom might be what we call a transient ischemic attack, or a brief period of time when patients have impaired neurologic function. For instance, suddenly an arm or a leg won't work normally, or feeling is lost on one side of the body or the other. Those would be typical sorts of symptoms of someone with carotid disease. Sometimes, unfortunately, the first symptom is a stroke. We don't have any warning before that happens. Nowadays, very commonly, physicians will, in their patients who might be at risk for developing this sort of trouble, do a screening exam with an ultrasound machine to look for evidence of carotid disease that might be treatable before a serious adverse event happens. We do offer free screenings through the Nebraska Medical Center periodically, I think about once a year now. And patients who we in our vascular laboratory would think would benefit from a screen are patients over the age of 60. Certainly any patient who in that age range who has a strong family history of atherosclerotic disease. Any patient who might be having these symptoms that suggest they might have a problem would be ideal patients to be screened. Any patients who have a history of high blood pressure, patients who have a history of of cigarette smoking might very well benefit from a screen. In most cases it requires intervention if it's a symptomatic narrowing. We see many patients who have some significant carotid narrowing who aren't having any symptoms. And what we know in that group of patients is that if they have 60% or greater narrowing of a carotid artery, then the risk of their having a stroke is about 2% per year, or over a 5-year period, about a 10% risk of stroke. And in those patients, we advise them of their risk of stroke and talk to them about options. And options in that group would be to either do a reconstructive procedure, endarterectomy or stenting, or to treat them with some medicines that we think over time reduce the risk of a stroke happening. I think most vascular surgeons now in the asymptomatic group of patients would not do a reconstructive procedure unless the patient had somewhere in the neighborhood of a 70 to 80% narrowing of the carotid artery. I would have to to say that I've been in practice for many, many years, and when I first began my practice, vascular disease was something that very few people knew much about. That's changed over the years, and I think people are far more aware of that now because of information through the media, information like this. That's made them more aware, but these are still, vascular disease is still one of the leading causes of death in this country, and I think it will behoove all of us to be informed about it and about the risk involved. It's not getting any better. I don't know that it's getting any worse. As patients and physicians have become more aware of vascular disease issues, I think we may be seeing more patients for that reason. I don't think the incidence has increased or decreased. We're able at this institution, because of the broad range of specialties and specialist experience, to bring some people together who are extremely knowledgeable about these vascular diseases and can plan out the most sensible and reasonable approach to treating them.